My research kind of goes between sports-related research as well as looking at clinical populations. And really with the sports side, it's not so much all research, but it's really getting in with these different sports teams and being able to use the technology to help them improve on performance. Switching over to the clinical side, right now I've got a study going on with surgeons at the Andrews Institute down in Florida, where we're actually looking at clinical outcomes for surgical repair. So really looking at shoulder arthroplasty. And right now the big thing is within physical therapy, as well as in follow-up visits, they just ask these patients, for one, paper and pencil questions as far as what their abilities are. And there's no real way to actually gauge that. It's it's really qualitative at that point. So we're actually doing this quantitatively, using the IMU sensors to actually pick up their ranges of motion, what's changed. Well, the really unique thing with technology now is that, we don't need these grandiose labs or these large spaces anymore, especially looking at that one that I'm doing with the surgical outcomes. The lab is set up directly in the clinic now, using those IMUs, the patients don't have to worry about traveling to another space. As soon as they're done with their appointment directly with the doctor, we can walk them right into one of the examination rooms and hook them up and collect that data right away. We'll see more and more of this usage and basically more qualitatively driven outcomes being backed up with quantitative information. We can actually produce this information and give these patients or give these athletes numbers to go off of. As we look at disease progression, we can see differences there. So in looking at stroke patients, hopefully we can collect prospective data in the moving and seeing what has actually changed, but also what can we do from a rehabilitation point of view. If we're looking at sports performance, what sets one athlete apart from another, as well as what are the adaptations actually occurring. But now when we can actually break it down to the motor units, what's that firing pattern look like as they progress, what's actually changing.